The data seems to be rolling in that indicates that we're about to enter what is being called the third wave of COVID. I would say, let's be clear, we're entering the third stage of the first wave. It doesn't really get to be a different wave if you never got out of it. And since we never did, I'd say it's still kind of the same thing. But I want you to take a look at this. This is a case and hospitalization information going back to the very beginning of the pandemic. We're gonna bring this up and you're gonna see you had that first big hit. Then you had, following the 4th of July, it started spiking once again. And now you can see that as you get to the end of that, cases are creeping up, hospitalizations are going up. We don't yet know for sure about deaths, although they're still effectively nearly as high as they've been at any point here. Yesterday, there were 57,000 COVID cases. That's a 10,000 case increase from one day prior. And there were 809 deaths. So not 1,000, but still a lot. And 37,000 people as of yesterday were hospitalized with COVID-19. And by the way, if we could show you one more chart, you're gonna see the tracking of hospitalization and case numbers. They do tend to go together. It's a bit of a lag, and then deaths tend to lag even more. But anyway, Gary, it's depressing to see after all that we've experienced as a country that it looks like it's gonna get bad again. And that second wave was worse in terms of hospitalizations and cases in the first. There's a chance that this third one might be worse than the second.
It's flu season. People are already in hospitals in large numbers during flu season. I was actually the supervisor of patient transport at a hospital here in Baton Rouge 10 years ago, right? And so I know what hospitals look like during flu season. And when you add a pandemic onto that, you're gonna have hospitals stretched to their max, and that's concerning. But I do believe that we're gonna see a spike because Halloween's coming up, and some people are gonna be out tricking and getting a treat of COVID, right? And they're going to end up with situations that because of football, right? Nick Saban has COVID, right? Director at Alabama. You've got football games being postponed, a week later, so we could play football next week because people got COVID this week, right? Like our priorities are out of whack at this point. That sports and entertainment has become more important than survival, and that is, a question that we have to ask ourselves as a society. That we can't put down these things for temporary moments of discomfort in order to be here longer, right? The scariest part about COVID to me is we don't know what the after effects will be on people in a year, right? We don't know what this will do to people from the medications or the treatments that people are taking as a result of catching this virus, what those impacts will be for a year later, right? And so, no, I am not interested in getting sick, right? And so I still wear my mask, I still social distance. And if you see me without a mask, I am probably around people that I'm very well aware of where they're at and what they're doing, right? Because I take it serious. And I think that because we have a president who had the best healthcare in the world, right? Socialized medicine is what Donald Trump has. Okay, and because he's got the best healthcare in the world and he caught coronavirus and he's okay, then there's a lot of folks who feel like, oh, I'll be fine, right? You don't have Donald Trump's doctors.
Yeah.
You don't have Walter Reed, right? You willing to risk their life in the car with you, and then they're gonna get amazing healthcare because they still have government insurance also.
Yeah, you don't have Walter Reed. Hopefully you've got access to healthcare. Like I'm gonna show you some numbers though, and God, look at this. So this is hospitalization information for 4 states, for Montana, Nebraska, North Dakota, and South Dakota. You see it shooting up. Now the absolute numbers are not massive there. You see it's hitting about 300 in Montana, but bear in mind there's like 500 people in Montana, so it's pretty bad. I'm kidding, obviously it's not that bad, but it's pretty bad. And for instance, you have hospitals in North Dakota are nearing capacity. Even just with a few hundred cases, they just don't have the capacity for so much. Right now, according to the public health director for Bismarck, the state's capital city, they said right now there was just one free ICU bed across the city's 2 hospitals. And so they are starting to set up again big tents where they can do sort of field medic setup and that sort of thing, which is fine. It's good. It's better than nothing, but it's not Walter Reed. It's not special antibodies. It's not whatever experimental monkey medicine that they put Donald Trump on. He got all the crazy, Dr. House stuff. We're not gonna get that if we get sick. So everyone needs to be careful. And Gary, you're totally right. We don't know exactly what the long-term effects are gonna be like. I'm sure that CBS is gonna do an awesome documentary about it in a year. But now is when we decide if we want to be suffering from those effects that we'll someday learn about. And there's a lot of Americans that have given up. They've been deceived by the media. They've been deceived by their president and told that they don't need to take this seriously. We each get to decide if we're gonna be one of those people and how vigilant we're gonna be. As I see these numbers go up, I hope that this time the deaths don't follow the pattern the way they have in the previous 2. But yeah, we're gonna hit it as flu season comes on. Everybody's expecting that the winter is gonna be bad. And this is happening right now. We've got a couple of weeks until the election. It's possible that deaths could be spiking in the days leading up to the presidential election. We'll see how much Donald Trump likes that, if it puts people's minds back on his lack of leadership in this pandemic.
For more political news, breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.